Good afternoon, ladies and gentlemen, and fellow Facebook netizens. Welcome to Island Hospital Facebook Live on dengue, chikungunya, and JE. I'm Dr. Peng Kiat. I'm a physician in Island Hospital. My specialty is in internal medicine. Let me start off by saying that we are now experiencing a pandemic of COVID-19 globally, and presently Malaysia is doing pretty well. But we must not forget that while we have this pandemic, we do not lose focus on other diseases uh, and other viral diseases. Today, I'm going to speak on three common mosquito-borne disease that's endemic in Malaysia. Um, Basically, I'm going to talk about three types of mosquito-borne viral diseases, i.e., dengue, then chikungunya, and Japanese encephalitis. So I'll start off with dengue. Basically, all these three diseases I'm talking about are viral diseases, similar to COVID coronavirus. They are viral. They are not bacterial, and however, different from COVID-19, which is spread by droplets. And these are actually spread by mosquito as a vector. First, we'll speak about dengue first. Dengue fever is endemic in Malaysia, and we do have a lot of cases. To put things in perspective, as of June of this year, there's already about 40,000 cases reported in Malaysia, as compared to COVID-19, which is about 8,000 to 9,000. So we do see a lot of cases, but before we go into other viruses, let's see. Okay, dengue fever is a viral fever that is transmitted by bites of mosquito, namely the Aedes mosquito. I will not be too technical. It's just an overview so that I'll just go gloss through over the disease. The dengue is there are four serotypes, main serotypes of dengue, and they are transmitted when an infected mosquito uh, bites a person, uh, and then it's transmitted to other persons through the mosquito bites. The types of mosquito that can transmit dengue would include the Aedes aegypti and Aedes albopicus. So how do we spread is by mosquito bites, and it would also mean that that's one of our methods of controlling dengue. The symptoms of dengue are usually uh, associated with fever. A lot of them would complain of bone pains and body aches, and there are usually rashes too. Um, the rash may be just red spots, fine red spots in the whole body. You could have what they call flushing of the whole body. The face is red, the body is red, as if you are lobster red in a sense. There is actually a term for the rash, and it is described as islands of white in a sea of red. That means you see white blotches in the whole body with flushed skin. You may also have bleeding type of rash, what we call petechiae, whenever the platelets or that controls bleeding becomes too low and you have a bleeding tendency. There are also other symptoms like anorexia, loss of appetite, lethargy, uh, and you may also have redness of eyes. Uh, a lot of patients do complain of gastrointestinal symptoms like vomiting, even pain over the upper abdomen, especially on the right side. If the disease become very severe, then you may become very dehydrated, you become dizzy, and blood pressure is low. Dengue has been described, can be classified into classical dengue, dengue hemorrhagic fever, and dengue shock syndrome. That's the old classification. Presently, to make it simpler, it can be complicated and uncomplicated dengue. This is just for us to identify patients that would be liable to go into bad severe dengue. Obviously, some patients may have very mild disease, so-called dengue fever, and more severe when there is bleeding tendencies, hemorrhagic. And the most severe would be the dengue shock syndrome, where the blood pressure is low. Um, we would monitor the patient. I mean, uh, one of the questions would be, how do we treat dengue? Uh, a lot of times, some of the patients may just require rehydration. That means just take enough fluids, take some medication for the fever, antipyretics. And being a viral infection, there is actually no antibiotics required unless there is a secondary bacterial infection. However, rehydration is the main key. We would usually ask the patient to be admitted if we find that they are having a more severe form of dengue and requires IV infusion of saline or colloids to prop up the blood pressure. Because one of the main problems in dengue is actually capillary leakage, where the plasma and fluids would leak out from the blood vessels into the tissue, and the blood pressure would drop. The doctors would usually monitor the patient by monitoring their white cell count and platelets and the hematocrit. Hematocrit is a measure of how dehydrated you are. Uh, Most people are aware that the platelets would drop. Personally, for me, I would usually monitor the white cell count, because I find that the white cell count is a better indicator of the disease. So you may be required, if you are in the hospital being managed for dengue, may be required to have blood taken quite frequently, usually almost once a day, sometimes twice a day, depending on the situation. The fever of dengue fever usually will last for 4 or 5 days. Then the white cell count will usually drop within the first 3 or 4 days, and the platelets will follow through. I would monitor the white cell count, and once the white cell count goes up, the platelets will usually follow about 2 or 3 days later, and usually uh, uh, you will at that time feel better to allow discharge. Most of the patients, if they do not what they call progress to a severe disease, would be discharged by the 1 week. Less, most of the severe cases would have presented much earlier. Sorry. Uh, how do we diagnose dengue fever? Obviously, we will look at the patient's history and whether they're coming from endemic areas, where there are patients in around the neighborhood having dengue, and we would examine them, check their blood pressure, see whether there is any bleeding points and petechiae, and we do some blood tests. Important blood tests that we done have mentioned will be white cell count, the platelets, and the hematocrit. And in order to diagnose dengue, we do now have certain tests, serological tests, and to diagnose it. Um, we would use dengue antibodies, the IgM and IgG, and also the dengue antigen, the NS1. The NS1 is more specific, and it would be positive much earlier. The IgM would come up positive about 3 or 4 days later, and then IgG will be much later. By looking at those tests, we can tell you whether you have dengue, whether you have a previous infection or a recent infection. So I will go on to the next viral disease, chikungunya. Chikungunya is also a mosquito-borne fever, and is also borne by Aedes mosquitoes. And it is actually a very similar sort of presentation to dengue. Chikungunya actually was described in Africa. It's a Tanzanian word meaning to be contorted, or your bones are bending. Usually the patients get lifelong immunity from infection, and so usually if you get it once, you shouldn't have it again. Presently in Penang at the moment, we have an outbreak of chikungunya, and the presentation usually would be fever, very high fever for the first few days, and a lot of body pain and joint pains. As mentioned just now, it is usually muscle pain. There'll be joint pains, joint swelling, and typically the rashes would appear about 4 or 5 days later, sometimes relatively itchy. I've seen patients with chikungunya presenting also with conjunctivitis, red eyes, and a lot of muscle ache, and is at times elevated liver enzymes too. Usually, chikungunya is a self-limiting disorder. You should it's not as severe as dengue, and it's not usually life-threatening. However, if it does occur in a very young and a very old patient with comorbid problems, the disease may cause some complications. Most patients will recover by the 1 week, and however, the joint pains and muscle pain may last longer. We have patients that have muscle pain and joint aches even 6 months down up to a year after the infection. Sorry. The treatment for chikungunya is usually symptomatic. They may not require admissions if they are mild, but symptomatic treatment for pain using paracetamol or any anti-inflammatory for the pain usually would relieve the joint pains. How diagnosis of chikungunya would be still by clinical diagnosis. That means a fever with multiple joint pains and muscle aches, and in an area where there is already cases of chikungunya reported, the diagnosis is usually clearer. We can confirm the diagnosis of chikungunya by serological tests also, which is they test the IgM and IgG antibodies towards chikungunya. However, it would usually appear positive a week after the illness. So if you do the test much earlier during the first few days of the thing, it will be negative. However, it doesn't mean that you don't have chikungunya. Majority of the patients will recover, and there will be a significant number of patients with persistent joint pains after that. To put in perspective, I think up to now there's about 400-500 cases reported. I think if the statistics is correct, it's about 400 plus in Perak, and in Penang there will be more. So the next thing that's coming up now, recently we had at least about 5 cases of Japanese encephalitis reported in Penang. Japanese encephalitis is also a viral infection. It's also transmitted by mosquito bites, but this time it's usually Culex mosquitoes, and it tends to be more in the rural areas. There is usually transmitted between humans and pigs. and birds by mosquito bites. It is quite, I mean, it's endemic in Malaysia, but the numbers are low, and usually uh, uh, they are not many of the patients develop symptoms. Only about 1 in 250 develop symptoms, and however, if they develop symptoms, some of them may be mild, but if they develop severe symptoms, we are talking about things like encephalitis, that which means infection of the brain. That will be swelling of the brain, and because of the infection of the brain, you will have what we call neurological symptoms. You may have headaches, you may have fits, you may have stroke-like symptoms, uh, neck stiffness, photophobia, basically signs and symptoms of brain irritation and inflammation. It can be quite severe, and mortality can range up to about 30%. Usually, it's a disease seen mainly in children, but it doesn't mean the adults do not have it. Okay, I'll just this few 3 minutes ago, I was just saying, giving you an overview. If you have any more what I call questions and all that, you can ask on Facebook or can see the doctor. I would handle a few. Okay, I would handle a few questions that's been posted. Um, One question that came through the Facebook was: is it possible the same mosquito carry dengue and chikungunya virus, and the infected person get both at the same time? Um, Honestly, I don't really can give you an exact answer. Possible, yes, but most of the time we do not see co-infection of dengue and chikungunya, although they carry the Aedes mosquito carries the same the different types of viruses. Um, um, but it is theoretically possible. By clinically, I have not seen both a person having co-infection at the same time. That means having dengue and chikungunya at the same time. However, in the test, sometimes we do see patients having chikungunya, and because we are living in an area of an endemic area, we do see patients having antibodies towards dengue, meaning they have actually dengue infection previously. But I have yet to see both infection at the same time. The other questions is uh, one question is, how do I know if I have normal fever or dengue fever? Um, Basically, where fever is not normal. It is an indication that your body is fighting something, an infection, or you have other causes like an inflammatory. But when you say normal fever, I assume that you're talking about things like influenza, respiratory tract infection, cough and cold. But dengue tends to be a lot of muscle aches and pains, rashes, and you will have a lot of hematological problems like your platelets and total white being low. Uh, if you have fever with those symptoms in an area where there is already some outbreak of dengue, the the answer would be to get it tested, and we can monitor carefully. Obviously, fever due to other things like a sore throat, infection in the lung would have other symptoms associated with that. Okay, would jungle hikers face high risks from these diseases? Well, hiking in the jungle, you are liable to be bitten by mosquitoes. The Aedes mosquitoes tend to be urban sort of dwellers, they are city dwellers, and Culex tend to be what they call rural. And if you're talking about jungle and all that, we tend to be exposed to more to Anopheles, what they call mosquitoes. They have different type of disease profile. Anopheles tend to spread malaria. Obviously, in areas where there's a lot of mosquitoes, you are at higher risk. So those people who goes out to the jungle and all that get exposed, depending on the type of mosquitoes are bitten and depending on the disease um, uh, profile that is available in that area, you are at risk. There's a question by Lim. Comments on drinking juice from papaya leaf as one of the common dengue home remedies. Okay, this is very common. Question are posed by patients of mine, and I'm sure all the doctors who are handling dengue, they would be asked whether taking papaya leaf uh, would help treat dengue. They claim that taking papaya leaf would increase the platelets. There are some small studies that was done to show that there may be some benefits, but the recommendation by Ministry of Health and all that is that this have no place in the treatment and it's not yet really proven and it's not recommended as a mainstream. However, I would say that in my practice, while the platelets is down, it is not the most important indicator. I tend to look at the total white, the blood pressure, and also the hematocrit to assess their hydration. The papaya leaf, we are not. I would not recommend it as a treatment. There might be also potential complications from using papaya leaf as a treatment. Okay, and there's another question by Mei Ting. Should a chikungunya patient temporarily stop taking cardioprin? I'll assume that the patient would have to take cardioprin for a number of reasons. Either the patient has ischemic heart disease or an old stroke before that you want to dilute the blood so that you prevent recurrence of the stroke. In chikungunya, the platelets, although they do come down, they do not come down too much, and there's not too many hemorrhagic problems or bleeding problems. I would usually say they can continue unless they have those symptoms like gastric pain, other bleeding tendencies, or bleeding under the skin. So basically, if those things happen, I would ask them to stop, but generally, no. Okay. If a mosquito bite an infected person and then bite another person, will that person get chikungunya? Well, if the mosquito was an uninfected mosquito and it bite and it got infected, basically that's how you would spread the chikungunya virus to another person. But it also depends on how much viral load and whether there's a lot of other mosquitoes around. Basically, when people ask me that, I will say you will never know which mosquito bites you. It's just that in that area, there will be mosquitoes with chikungunya virus, and you'll be not just one, there'll be many. So the basic treatment or control or prevention of all these mosquito-borne illness is to try to control the mosquito population. Hence, things like fogging, taking care of your surroundings, no stagnation areas, stagnant waters, no, and maybe nettings and all that stuff. Okay, there's a question about vaccines for these diseases. Okay, chikungunya, presently no vaccine. Japanese encephalitis, yes, there are very effective vaccines. They are recommended for people above 2 years and beyond. Now they have very effective vaccines, and it should be recommended to patients who are living in areas where there is an outbreak, and it is actually a recommendation by CDC for travelers to areas with what I call Japanese encephalitis, and if they are planning to go to that area, staying for long periods of time and doing a lot of rural hiking, rural traveling, or if there are people who are working with labs that deal with Japanese encephalitis virus. So that's effective. Dengue vaccine, at the moment, there are vaccines that have been produced. The moment the recommendations were to give to people who already had at least one episode of dengue infection, and it's not recommended below the age of 9. However, in Malaysia, this is still not yet really accepted in the mainstream, and we are probably looking more for a better vaccine. Uh, there's a question about whether contracting dengue leads to more health complications in the future. Majority of time after you've recovered from dengue, you are usually quite normal. There shouldn't be any long-term complications. Uh, I mean, if you did have a very bad dengue shock syndrome, there is definitely a mortality rate to that. But those who have recovered, usually they're okay, and they may do complain of lethargy for long period of time, but there shouldn't be any long-term complication. You may have, you may have, you don't actually have immunity to dengue in the sense that there are four major serotypes, and you theoretically can get at least four times of dengue fever. How long is the recovery process of patient with dengue? Um, Most patients, if they will take about a week. Most of the time, if you already have dengue, after 1 week of the infection, you are usually out of the what we call danger period, the danger zone. If you do develop severe dengue fever, i.e., dengue shock syndrome and hemorrhagic, you would be evident quite early, maybe the fourth or fifth day, and at that time we would know that you are in the complicated group. But majority of the patients should be okay by 1 week or so. What happens if dengue is left untreated? Well, there are some patients who have what they call subclinical or asymptomatic dengue. They may recover by themselves. I mean, they will probably try home remedies, taking paracetamol, drinking fluids, and they'll be all right. However, if you do have severe dengue, you have a risk of going into shock and bleeding complications. So those situation is very serious, and there's a high mortality rate to it. I would advise that this patient should be admitted, monitored carefully with their parameters, and the treatment of choice would be still rehydration and try to prevent hypotension. How is dengue different from chikungunya? Symptom-wise, chikungunya tends to be more joint pains, body aches, and they are usually less severe in terms of um, fertility and mortality. They do develop residual joint pains and body ache for long periods of time. Reports have stated that it may be there for 6 months to a few years, but majority of people recover. Um, Somebody asked about the fertility rate of dengue, chikungunya, and JE. Chikungunya, majority of the time, they are not lethal unless the patient is very, very ill, have other comorbid problems. JE, just now I presented the fertility rate is about 30% for those people with neurological symptoms. Dengue, I don't have an actual figure, but majority of the patients do, recover. Those people who go into dengue shock syndrome, the rate can be quite high. So I've mentioned about vaccine for dengue and chikungunya. There's no vaccines. How severe chikungunya and is it fatal? Also mentioned. The severity in chikungunya is usually the symptoms, pain and joint pains. Fatal, rarely. Best treatment for dengue, chikungunya, and JE. Okay, basically they are all viral infections, and a lot of patients would ask me whether antibiotics will be required and all that. Usually none. For dengue, it is usually a symptomatic treatment, treatment with rehydration, antipyretics medicine like paracetamol. We will not use things like anti-inflammatory like ibuprofen, Ponstan, NSAIDs for dengue because they affects the platelets activity. We may need have to give transfusion of plasma or colloids to prop up the what they call blood pressure, and there's supportive therapy. They may have leakage into the lungs, and they may have liver impairment in severe dengue, and they are all supportive therapy. Chikungunya basically will respond to just pain relief and paracetamol. Japanese encephalitis, also no actual treatment. We will treat whatever the symptoms are, the neurological symptoms. We may need to do special tests to diagnose JE. I forgot to mention that there is also a serology test for JE, but if the patient do develop meningitis or meningoencephalitis, a procedure called lumbar puncture may be required, and either CT scan or MRI of the brain may be required for help of diagnosis. Who should get JE vaccination? I've mentioned whoever goes to areas with JE infection outbreak should get it. At the moment, there's a vaccine that is given once, and then you should get a booster a year later. How soon do people get sick after being bitten by infected mosquito? The figures, the incubation period is roughly about two days to 2 to 3 weeks, but majority will get infected by the week. Yeah. Any other questions now? So I have to stop here. Uh, thank you for allowing me to share a few tidbits, and we just need to be vigilant and take care to prevent mosquito bites to ward off all these diseases. Thank you.